Welcome to What She Does, the podcast that takes you inside the working lives of everyday women shaping the world around us. I'm Leanne Starr.
And I'm Annie Sinzinger. And each week, we sit down with someone who shows us not just what she does, but how and why she does it. Plus, find out if you fit the same mold to grab the same type of gig. Let's discover
What She Does, starting now.
Today, we're joined by Dr. Tsolair Hovsepian, a general dentist who has been serving patients in Los Angeles for more than 20 years. A graduate of the UCLA School of Dentistry, she opened her family and cosmetic practice in Encino in 2017 and focuses on personalized care that helps patients look and feel their best.
So, Tsolair, you're a dentist?
Yes, I am a dentist, a general dentist. Yeah.
And what is a day in a dentist like?
Well, the nice thing about dentistry is that it's pretty flexible. There's so many things you can do as a dentist, but generally, wherever you are, you're seeing patients throughout the day. There's different specialties. I'm a general dentist, so I get to do anything I want, or I can, refer out to specialties if I don't feel comfortable with any specific procedure. So generally, I do like bread and butter, what's called bread and butter dentistry, which is exams, cleanings, the regular checkups, cleanings, and then we do things like fillings, crowns, bridges, dentures, cosmetic work, whitening, things like that. And then there's like the more specialty type of procedures, which generally I refer out to specialists. So things like root canals or surgeries, implant surgeries, most orthodontics, with braces. I do a little bit of Invisalign, but most orthodontics also I would refer out to specialty dentists. So most of my day is just the routine stuff to get people comfortable and chewing again.
Um, that seems like this is a really good job for somebody who is a caregiver because
Yeah.
you have flexibility.
Yes. When I first started out, I was pre-med just like everybody else, and although with medicine you can also be flexible, but I thought with dentistry, especially the people I talked to who were dentists and they were female dentists, and they said they were able to have a good work-life balance because you can have your set days and then you could go home to your family, and so that was a big part of why I chose it, and that's a real big part of what helps, me out with everything. So yeah. Yeah.
And then the flip side of it, what do you think is the hardest thing about being a dentist?
The hardest thing is, although you see the routine, procedures, you also there's a lot of responsibility, and in my case, I own the business too. So with owning the business, it's you have to take care of everything. So even when you go home, you're thinking about all the business side of it, all the odds and ends. So I think for me, that's the most challenging part is just trying to balance. It's kind of like having another like family or kids. So for me, it's the business part of it that's the most challenging. Although, the work itself, there are procedures and situations that make you think a little bit more and take more out of your mental space. So
Mm.
you still have to be able to create your own boundaries. When you go home, you have to like shut it off and, when you want to be present for your family. But yeah, I'd say that would be for me the most
Do you
challenging.
have like a best story or wildest story or an unexpected story?
Um, Well, that's a good question. It's not wild, but what kind of like shocks me in the best way possible is when I see a patient and they haven't been to the dentist in a long while and they've neglected their teeth, they've neglected their entire health, and they they come to me and they say, I'm sorry, I have neglected myself, but I'm here for you to help me out. They usually come in with a concern and so forth, and you think, okay, there's a lot to take on, and you think that you don't know if the patient will be able to listen to your advice or take your advice and be able to turn it around and take care of their, oral health and, get back to a more stable place. And, like with everybody else, come in, you do what you need to do, you give them your advice, and then you want them to come back for, the regular checkups. And sometimes the people that you least expect to listen will come back and listen to all your advice, and just on their next visit, they come back to a completely different mouth.
Yeah.
And and it's so shocking and it's so amazing and it fulfills me so much that I said, like they listened, my advice, really helped them out, and on top of it, they said not only are they taking care of their teeth, they're taking care of their health. They come back completely changed, and it shocks you because
Oh,
you didn't think that that little bit of time that you had with them, that you met them, made such an impact, and then they forever, they thank you for that, and it's something. I mean, I try and do that same thing for everybody, but for them to take it and really make a difference in their own lives, and you see it with your own eyes, it's just it's a good shock to have, so I'd say, yeah.
and also I was thinking, being a dentist, you have to deal with stuff that like bad breath, people don't floss, people bleed. I mean, what is kind of the low point of
Yeah,
dentistry?
then you do have patients who don't they come to you regularly, but they don't do their home care, and you see that there's a whole bunch of reasons why and how your teeth and mouth can go downhill, but a lot of
Mm,
genetic, most of it is your home health care and your own hygiene, there's diet and things like that. When all of the above is working against you and you still, there are people who still don't, you know, brush regularly, they don't floss regularly, and, they come to me and they want me to help, but, you see gums and teeth go downhill very quickly, and
mm,
it's sad to see, but we do also see that, the gums just in terrible shape and the teeth getting decayed, broken, and then they have to deal with it every day because they can't chew. We use our
oh,
mouths all day long for chewing, talking, speaking, and it's not just a random body part that we don't even think about. It's a day-to-day, thing that they are uncomfortable and increasingly uncomfortable, and then we deal with bacteria, it's infection, and then it affects the rest of your body. So when you see that, it's, breaks your heart. And contrary to the other side, what that happy shock, it's kind of a sad shock where I can only tell you so many times, but you have to take it and, and
mm.
until they get to a point where it's really uncomfortable is when they might make a little bit of a change. But yeah, we do see
Oh.
that too, unfortunately.
Do you have a standout horror story?
Uh, I y I mean, a horror story, at top of mind right now is, there is a case where, his teeth I don't know if he, brushes at all or flosses at all, and he just really I mean, it's just you don't know where to begin every time he comes in for a regular cleaning, and
Oh
all
my
the
god.
questions that, it's almost like he has to, remove all of his teeth, and he doesn't even wanna take out a single tooth, but let alone everything, and it's like I said, it's one thing where, like, okay, you deal with it, but when there's infection and health issues, y y I I have to tell him, "You're gonna lose all your teeth," and I don't like to say we don't like to give that kind of news, but, you
Oh,
say it and he gets scared, but then, it just keeps getting worse. That's probably the biggest horror story.
yeah, that
These
seems
teeth.
like a big one.
Yeah, yeah,
Um, it would be hard to tell somebody, "Hi, I have to pull out all your teeth."
yeah, and then when they come into you every day, not every day, like, every time for their regular checkups, and you have to say the same thing, and you see it getting worse. When you think that it can't get
Mm,
worse, it is getting worse.
wow.
Yeah.
That's Terrible. Can you talk a little bit about the business side of it, of what you have to juggle as a dentist or as a dentist who has their own practice?
Yeah. Um, my business is a very small business. I've kept it small because, it's the easiest way that I can have control over it enough to where I can manage my time. So I basically do much of everything for us. Just what I have to deal with is obviously there's rent. So
Mm,
there's the landlord, rent issues, and then we have our equipment in the office that keeps the business running that we always have to maintain. Um, and then, supplies, dental supplies that we have to be on top of and make sure we keep a good inventory. Um, then we have employees. We have our dental assistants who help us chairside. Then we have front office who deals with scheduling, insurance checks, a lot of the insurance things where they want to make sure the patient is covered and then how much things cost. And then we have hygienists who basically only do cleanings. For example, I have a super part-time hygienist. I do most of my own cleaning, so a lot of dentists do their own cleanings, but, when we get busy and have to do more of the dental work, there is a staff member that just does cleanings. Those are the bare bones. The insurance billing is a huge part of, the dental
mm,
too, which, you have to deal with insurance companies, which makes things a lot more difficult. But yeah, and then, just the basic bookkeeping. Um, yeah, it's sounds simple, but it just I'd say it takes up most of my time. I do more of those things during my time than actual dentistry. So it can get exhausting. But you can, I had a chance to expand. There were times where was able to expand, but for me, I have 3 kids, so a lot of my time is with them. So this was the best way that I could manage it, just to keep it small and simple. But there's still a lot of work, So
it doesn't sound simple, by the way.
yeah, okay. So
No, it doesn't. I
no
was gonna
problem.
ask you yeah, I was gonna ask you what you think the biggest pain points are as a business owner on top of, being a dentist.
Uh, Basically, the thing about and I'm sure the medical industry is a lot worse, but for us, I only take the PPO insurances, so there's also HMO. That's a whole 'nother,
Mhm.
uh, conversation, but the insurances that I take, basically reimburses you for the services. So,
Mm,
there is a process, and although it's gotten a lot more streamlined over the years where it's just through a software and it's electronic, but you still, the patient it's not like a store where the person comes in and, they get a service and they pay and they walk away, even though, I do have some just pure cash patients. But most of, my business is based on insurance reimbursement, and, so we always have to wait on the insurances to send us the
mm,
payment, but our bills don't wait. So we always have to
Mm.
be very, on top of our money management and the timing, and a lot of it is unpredictable because the higher paying services that the insurances have to reimburse, they take longer to pay, and so, that's the most challenging part, just to kind of make sure that the cash flow is regular. The billing has to be done really efficiently just to be able to get reimbursed in time. So that's
Mm.
definitely the hardest part for me. You
and so the other thing I was thinking, I haven't really heard a lot of about female dentists. Like, is it
know?
a very male-dominated field? Have you, got any pushback for being a female dentist?
Good question. When I went to dental school, it was in from 2000, 2004. Our class was the first class that we had an equal number of males and females, and it was a big
Mm.
change because in the years prior there was always a lot more males than females, but then there was this movement where we tried to bring more females into the entire medical industry. So there have been, because I was part of that generation, where more females were being introduced into the practice, whereas the older generation dentists who were in the field and mentors and so forth were male. So I was stepping into very heavily male dominated field. And I did, you do feel a little bit of the, I don't know, not the not so much discrimination, but you do feel
Mm.
like you're one step behind and you always have to, put your best foot forward just to prove yourself as a female dentist. Through the years, now, there's a lot more females in the field, so I think it's a lot more accepted. But in the beginning, when I first started out, working out, as a dentist, I did feel, I don't know if it was just mentally because I was trained in a very heavily male dominated field, but I just kind of took it with me in practice, and I just felt like I always had to do a little extra just to prove myself. So yeah, but luckily now there's a lot more females, in the industry, so people are used to it. And over the years, people have told me, a lot of patients like, at first I wasn't sure about I've never had a female dentist ever, but now that I see that, you're very gentle and, I see the perks of having a female dentist. So people have told me references like that. So, you know.
Oh,
Just be confident and just know that, what you bring to the table is just as good and you can offer good care. And once you gain their trust, then they treat you like anybody. So
do
yeah.
you think there's anything that, yeah, as you said, they said, "Oh, female dentist, you're very gentle." Is there anything that you think that you bring to the table as a dentist that is perhaps something that they don't get from men besides being gentle?
Yeah, and again, these are things that people have told me too. I feel like, as females, as women, as generally we're caregivers, we're moms, we help our families, our friends. We do bring a maternal instinct to the profession. And in our profession, there's a lot of anxiety that people come in with. And
Mm.
when you bring out that female, that maternal, that instinct that we have, that males don't have, but we have as females. I mean, it's just a natural thing. I think people get this comfort that that re- brings it, like, refreshes them and makes them a little bit more comfortable and willing to sit through that appointment. So yeah, and I found for myself too, after having kids too, I
Mm,
found that I was able to kind of quickly go to that maternal instinct when I see patients too. So I treat them like family like that. So, and patients have told me, have made remarks that, I just feel very comforted by you. Which I'm not saying that men don't bring, they bring, their own paternal instinct, but the maternal instinct we have can bring something positive to the patient experience for sure. Now,
Solaire,
yeah,
I was just kind of wondering, besides the inherent, qualities that you bring as a female, as yourself,
yeah.
what are some of the other skills that somebody needs to know to have to be a good dentist?
Intuition. I think gut
mm,
instinct for me, over the years, I found my gut instinct to be greater and greater. And then I was just talking to somebody about this, but like I'm like, how is my instinct so become so good? But I thought, it's part of my job because a lot of times people come in and not everybody is very in tune with their health or oral health, and they coming to you for help. And we have our things that we look for when we're trying to figure out what's going on. But then there's a lot of it that's not clear, and you have to just go go back and listen to your instinct and just figure out, you know, it's like a holistic view of things so that you can figure out what the issue is, what the person is looking for, and so that you can give them the best advice and service. Because a lot of times, if you just go in with a technical mind and you're like, okay, I see these problems and these are the problems we need to fix, but that's not what the patient is coming in for. That's not what's bothering the
mm.
patient the most. And you have to prioritize why they're there so that they can, first of all, trust you that you are listening to them, but also be able to get them to a point where if you do see other problems, then you can go and address everything else. So that's been big for sure.
And I realize dentistry has no threat from AI, but
Yeah.
is there any sort of tech aspect that's coming up that you have to deal with?
Good question because, people are like, "Oh, this is a profession that AI can't take over." But,
Oh, no.
I would understand well, there's a telemedicine aspect of it, which people always go to the Google AI to figure out their problems. That's one thing. But, a lot of our work is hands-on, and that a computer can't do, but they are they are coming out with robotic devices that actually do certain dental procedures. For
Oh,
example, I
no.
know that there is robotic technology that places implants for the surgery. I know some
Oh,
doctors utilize that technology. Somebody came in and said, "Oh, you referred me to this doctor for an implant surgery, and they gave me the option. Do you want me, a human, to do it for you, or do you want my robot to do it for you?" Yeah,
What?
yeah.
okay.
Wow.
And I don't have a single patient that's chosen a robot, so everybody does prefer the human, but
Yes.
there is that technology, and I can see how obviously for that to happen, that's gonna because 'cause I'm sure that equipment costs a lot of money, so there's gonna be a that for that turn to be taken, there's, like, a lot of investments and a whole change that needs to happen to, you know, go into that aspect, but it's kinda, like, there already, so
Oh,
robots.
God.
Well, I don't think you'll be replaced, though. I mean, similarly, those things might just take care of certain procedures, and
Yeah,
then you're still being consulted.
exactly, and like I said, there's something to be said about the intuitive part of your patient relationship that computers can never get,
Mm,
so that will always be there for people to look for, so
yeah. We won't be replaced.
So, Lair, what would you tell your younger self?
Okay, um, you know don't stress out about the details. Don't stress out about the future. Live in the
Mm,
moment, treat each day at a time. I spent so many, to become a dentist, had years and years of just pushing forward and looking ahead and planning ahead and, and you have all this whole idea of what you want to do and you have to go for it and but as the years went by and everything, life happens and things happen, and then you get to a point in your career where you're comfortable and it's I find myself just looking at things one day at a time, and
mm,
it it releases the anxiety off of you. It, prevents burnout. I mean, there have been so many, I'm not gonna lie, there's so many instances in my career where I just burnout was a thing and you just contemplate just saying, I'm ready to quit all of this. And
mm,
that takes away from your mental health, your physical health, spend so much time stressing. But when I changed my thought process to, let me just get through each day and at the end of the day, just be thankful that, I went through my day, did the best that I could, you sleep better at night, your health improves, and then you're more present, to your loved ones and the people around you because you're not so overwhelmed with the stress of your career. So I'd say if I was able to do a little bit more of that, I wouldn't have stressed out so much over the years, but it's okay.
that's so nice.
Oh, yeah,
Yeah, and I did not know robots were coming for
yeah,
for a team.
yeah.
Thank you so much.
Thank you so much for having me. I really
Yes.
appreciate it.
Thank you.
Thank you.
So, I think everybody's been to the dentist, right? I
I
mean,
hope so.
well, one would hope. I mean, since being a little kid to, your elderly age, you kinda have to go to the dentist.
You
I
gotta
mean,
get the dentist. You gotta get your
yeah.
hopefully, you have to get your yearly cleaning.
Well, you do it twice a year, right?
Yeah.
So
Yeah.
So to meet Solaire, she was really great about kind of sharing her interest in it. But
Yeah.
man, you got to go through a lot of schooling.
Oh my God, a lot of schooling. You had to
I
become
mean,
a doctor.
yeah, I mean, you have to have a bachelor's degree. You go on to get an advanced doctoral degree. You don't have to have a specific major. Like there's not a they don't say that you have to be X, but dental schools prefer that you have a science degree, which
Mm,
I get because there's a lot of science involved.
yeah.
So if you have biology or yeah, I guess you could do chemistry, I guess, a number of other things, but they have to be science related. And then of course, just like I think just like medical school, you have to have certain initial requirements. And then, the coursework involves a lot of things like anatomy.
Yeah.
And
It's not just
yeah,
teeth.
no, no. I mean, because the teeth, things around the teeth and the gums and stuff affect other parts of your body.
Yeah.
Now, the thing I didn't know is that the programs typically include coursework in local anesthesia, periodontics, and for those of you who don't know what periodontics is, it is about oral health, and so your gums and stuff like that. And you also have to do radiology, which makes sense because you get your
X-rays.
annual X-rays.
Yeah.
So that's a lot of different stuff to know.
Yes.
And then on top of that, you have clinical experience that you have to do, which includes 2 to 4 years of residency after dental school, and if you are doing surgery, so if you go into dental surgery, which is like a specialty beyond, you have 4 to 6 years, which then at that point, you've also potentially gained a MD degree as well.
Ugh, yeah.
I'm like, these are people who do a lot of schooling,
Well, but
but I did find that general dentists do not need additional training after dental school. So
oh,
this is all a lot of these other things. I mean, clearly you have to do residency and stuff, but you don't have to actually because you're not in a specialty, you don't have to do all this other stuff. So for those of you who are interested in becoming a dentist, this is definitely not something you could just pivot into.
no. I think
But
I'll be a dentist.
yeah.
Yeah.
I it's not like I'm gonna wake up tomorrow and say I wanna be a dentist, but I appreciate having a dentist. And the thing is, though, if you're a high school student and you're actually interested in things like biochem and math, or you have a strong interest, then you could follow the path of a dentist.
And there's growth.
And there's growth. Yes. I mean, interestingly enough, growth in the dentistry field overall is 4% over the next several years. So, when we're thinking about growth, the reason why, or the two things I found that were why there's a growth in dentistry, like as a profession, is one, aging population,
Mhm.
and two, a growing popularity of cosmetic dentistry. So, people wanting to have like really nice looking teeth, right?
Teeth bleaching,
Yeah, bleaching, straightening, all
veneers.
those things. So, the Health Resources and Services Administration reports there are 59 million Americans that live in dental health professional shortage areas. So, in other words, they don't
And
have enough
dental
dental
deserts.
Yes, there are dental deserts too. Food deserts, dental deserts,
Wow.
medical deserts, a lot of times in rural areas in particular. I think Solaire talked about the fact that having to deal with insurance companies is part of the job as well, because that's how they get paid. And it's difficult because now they're just grouping into these organizations. You have to be part of like a service organization, which I'm sure impacts like how they get paid and all those kind of things too.
And speaking of pay, that's pretty good.
Yeah, the pay is really
Really?
good.
Yeah.
Although I think it's really interesting that the median pay is only 179,000.
Mhm.
I mean, that might sound a lot. I mean, it's definitely a lot compared to like the average or the median pay of a typical worker, but it seems kind of low for somebody who's gone through so much schooling.
Schooling, yeah.
The median wage for specialists actually go up above 225. So
Yes.
you can do very well as a dentist. And the most opportunities apparently are in places like California, Texas, New York, Florida, and Illinois. The bigger states with bigger populations, which makes sense.
And more teeth in California.
Yeah, more teeth. More interest in cosmetics dentistry, I
Yeah.
guess.
So, it seems like this is a good direction to go in.
Well, I would
It
think so. I mean,
it
I do think that the personality wise was really interesting because
yeah.
we've dealt with a lot of people who are like extroverted, but I didn't find that the most common profiles for dentists or personality profiles were extroverted. They're more
Huh.
introverted. And yet the common things about the profiles were around being really precise, so precision and attention to detail, being really responsible, having a high caregiving instinct. Those were like kind of the common things.
Yeah.
But I mean, I guess in some respects, when you think about the combination of skills, medical knowledge, technical precision, patient empathy, and then you have to pair that with business management because you're running your own practice. I mean,
Mhm.
that's a lot. That is definitely a rare combination of skills. So
Yeah.
it takes a kind of special set of traits to become a dentist.
Yeah, and, tolerance for bad breath. Uh, but yeah,
Yes, and bad teeth.
and bad breath, bad teeth. Yeah.
Yes. Well, cheers to dentists because 'cause they're keeping my teeth clean and healthy.
No, it's all good.
It's all good. Thanks for joining us today. That's what she does, and maybe what you could do too. If you like what you heard, make sure you follow What She Does wherever you get your podcasts.